All right, next story here. Let's see. Sticking to health stories here. So the title here, this is from 15 October from Friday. The title is States Linking Prescription Databases, Fight Abuse. This is from Raleigh, North Carolina. Starting next year, dozens of states will begin knitting together databases to watch prescription drug abuse, from powerful painkillers to diet pills. With federal money and prodding, states are being asked to sign on to an agreement allowing police, pharmacies, and physicians to check suspicious prescription pill patterns from Nevada to North Carolina. Civil liberties and privacy advocates have objected to the state databases, which would be linked to technology and standards developed by Justice and Homeland Security departments. 34 states operate databases to fight a drug problem. Authorities say it is growing more deadly than heroin, and we have a code here from a sheriff in Lee County, North Carolina. Quote, I've got people that are kin to me that's addicted, and I see firsthand what it does. The thing that's so damn frustrating, I'm quoting him, is our young people don't think that it's that big of a deal. So, Kat, yeah, I mean, I've read studies too that, prescription drug abuse is more prevalent than illegal drug use, and it is a huge problem nationwide. I know in my state here in Ohio, we have a state database too. So people are really trying to, tackle this problem of prescription drug abuse.
Well, I mean, they do that kind of anyway with the doctors, right? This is to check how people are using it, like
Yet
the people who are actually.
that's right. That's right. Yeah, because it's been known for a long time that patients quote unquote doctor shop, so they get prescriptions for
Yeah.
narcotics from doctors in different counties and different cities, and there has really never been a way to track these patients as they go to their different doctors in different cities and different counties to get their prescription drugs, and it's a big problem.
Yeah. I mean, I can kind of see both sides of it. Like, okay, well, that does seem like an invasion of privacy, right? But I mean, in the end, they're going to be saving the person's life most likely if they can, stop them and get them help. I mean, are they going to put them in jail or are they going to send them to rehab? I mean,
Yeah,
if that's going to happen to you.
I think it depends on the state law, what it is per the state. So that'll be interesting to see how each state deals with the problem.
Because I think that anyone who has a problem with any drug, whether it's legal or illegal or how they get it, should be offered the chance to rehabilitate first. Unless, I mean, if you're selling to little kids like dope or whatever, that's a whole different thing. But if somebody's taking drugs on their own and they're addicted, and but they don't hurt anyone else, they haven't been, it's not like they were using drugs and then, you know, had an accident and hurt somebody else, then give them a chance to rehab, because it's a disease, and it's unfortunately because, and that's the bad thing with prescription drugs too, because when people start taking them, they're taking it to help whatever problem it is, whether it's pain or anxiety or whatever, and then before they know it, they're addicted to it, they're dependent on it, and it is so powerful what addiction can do to people that their brain can start, you know, their brain talks to them different. I mean, it's like part of the disease is your brain tries to make you think this is okay. If you have to go to another doctor, go to another doctor. You just need this. You need this drug. Your body tells you that. Your mind tells you that. And so, you know, a lot of times people who are addicted to these prescription drugs, even though they're doctor shopping and all that, they don't even totally realize it themselves that they're an addict. Oh well, this is legal, so I'm not like a drug addict. I'm not like a heroin junkie. Well, it's all the same thing, really. It's just a matter of what's legal and what's not. It's all the same thing. So it's I'm not sure really how I feel about that. I can see both sides of the issue. It does seem kind of like, God, what else are they gonna do? You know, come see if I'm drinking too much in my house or maybe eating too much sugar. You know, but you can understand. And I knew that they would do that for the doctors, and that would be doctors that are just being haphazard with it and not engaged whatever all the time, and a lot of doctors you'll see, at least with the anti-anxiety, like Xanax and Valium, the only times they give it is if somebody's like, let's say they had a death in the family or something, they're going through something traumatic. They may give them a month, 2 months, 3 months of the pills, but then they stop. They don't prescribe it month after month after month for such a long period of time. You rarely see a doctor do that.
Right.
So I get surprised when I hear people say that they have a prescription for that and they have it every month. I mean, I'm like, how do doctors get away with that?
Yeah, I don't. That's a good question.
It's like, I mean, unless you're under the care of like a psychiatrist with a severe, and you have a severe anxiety disorder, or bipolar or something real severe, not just because I mean, a lot of people have anxiety. A lot of people, but Xanax is such a heavy-duty drug, and that's one you see prescribed pretty often.
Yeah.
But for such an extended period of time, it kind of surprises me.
I'm reading some feedback in the chat room here. Dr. Jonathan says also many addicts dentist shop. Some dentists will call in prescriptions without seeing the patient. Let's see. We have a Dr. Hamlet 423. Like mental health services, finding rehab that is decent and available is not so simple. That's true. Um, and many clinics in Pennsylvania have anti-controlled substance policies where they write no controlled substances. So yeah, I mean, I know at least that I see, or in the people that I talk to, my peers that I talk to, that prescription drugs is a difficult thing to try to get a handle on. So, and I see your point there too. I mean, you can go too far with any of these type of policies and things. It's just, how far is too far, and people will kind of decide that. Maybe even take the courts to decide how much is too far when you're going with some of these policies.
Right. Well, and like I said, on the other side of the coin too, they could be saving someone's life, you know. So it's like, how do you balance it?
Yeah.
I mean, I guess doctor shopping to me, though, I mean, if you have the same doctor that's giving you a prescription over and over and over again, you have to look kind of too at the doctor as well. But if they're doctor shopping, then in a way they probably are. I mean, I guess that could be that should be like a breaking of the law, because it's like, even though it's a legal drug, you're being shifty about trying to get it.
Right.
You know?
Right.
If my doctor, if my doctor won't give me anymore, then I'll go to someone else. Well, there's a reason your doctor's not giving it to you anymore.
Right.
Think about it.
Kimmy says when she worked in Seattle, their kidney doctors or nephrology doctors prescribed a cocktail of Xanax and Benadryl to almost all their patients. She says she hated it, thought it was awful. Dr. Jonathan says also if a pharmacist suspects abuse, she cannot and should not fill the prescription. So yeah, so pretty good discussion here in the chat room on this topic there, Kat.
Oh, well, I will say this too. When I did have the cancer, because that made me, what Kimmy said kind of brought up a point that made me think about when I was going through chemo. Whenever I would actually have the chemo, they would give me like Ativan, okay, which is in the same family as Xanax and all, but it's more fast acting. And then for the first 3 days after a chemo treatment, I would get it every 4 hours on the hour. And I was so out of it, like I didn't even know my parents were giving it to me. I would take it. They would wake me up. I would take it, and I wouldn't even remember taking it. But I had to be that drugged up for the first 3 days to handle, because it was such an aggressive chemo. And but on the rest of the time, because I had chemo every 2 weeks, I never took it. I wouldn't take the Ativan anymore. I saved it for when I had actually the treatment. And also, some terminal, they should be allowed to take as well. I guess they would be allowed to take whatever they had to, if they're terminal, or if they're, like I said, going through chemo, at least through the course of the treatment, there's got to be instances where it's okay.
Right. Right.
Because you can't expect a cancer, or God forbid is terminal, to not have medical, the what am I trying to say?
Necessary.
The necessary medicines, even though they're hardcore narcotics. I mean,
Right.
so I guess this is for more like people who are dealing with anxiety or other things, or chronic pain. How do you decide this person's chronic pain isn't serious enough to have chronic pain meds or pain meds all the time? How do you decide whose pain is, you know what I'm saying? Because I know that there are people who doctor shop that probably aren't in that much pain or aren't that anxious. They're just addicted to the drugs. But how can you know for sure who really needs it and who doesn't, too? So that's another thing.
Yeah.
I think if they're doctor shopping, that's a good way to know they probably don't need it.
Right.
They
Right.
wouldn't have to doctor shop if